CPAP versus oxygen in obstructive sleep apnea. What is the OSA? It is the most common type of sleep apnea and is caused by obstruction of the upper airway. It is characterized by repetitive pauses in breathing during sleep, despite the effort to breathe, and is usually associated with a reduction in blood oxygen saturation.
Obstructive sleep apnea syndrome or
Epidemiology. Obstructive sleep apnea is a highly prevalent chronic illness in adults, affecting an estimated 9% of middle-aged women and 24% of middle-aged men, with 4% and 9% respectively, having moderate to severe obstructive sleep apnea. Cohort studies have shown that obstructive sleep apnea is a risk factor for hypertension, coronary heart disease, stroke, and death.
Obstructive sleep apnea, or OSA, is a potentially life-altering.
The mechanisms underlying these associations are thought to include sympathetic activation, oxidative stress, and inflammation.
When you breathe, air travels through your...
Although reports clinic-based studies have indicated that cardiovascular risk is reduced among patients with obstructive sleep apnea who are treated with continuous positive airway pressure as compared with those who decline treatment. One randomized trial designed to evaluate cardiovascular risk reduction with CPAP was recently published, but it was limited by inadequate statistical power.
Keep going.
Todd hadn't.
Group assignments and interventions. Randomly assign participants to one of three interventions: healthy lifestyle and sleep education alone, CPAP with HLSE, or supplemental oxygen and HLSE. Outcomes. The CPAP group had a 20% reduction in the mean level of C-reactive protein at 12 weeks, as compared with the control group.
Obstructive sleep apnea.
Conclusion. The treatment of obstructive sleep apnea with CPAP, but not with nocturnal supplemental oxygen, results in a significant reduction in blood pressure, even in patients with well-controlled hypertension at baseline.